So we are here today in our very last day of the Structural Summit at a unique hotel in São Paulo. And we are very privileged to have Dr. Professor Bernhard Prendergast, who is a well-known structuralist, educator in the interventional field. So Bernhard, thank you so much, first of all, for coming and for your big contribution to the field and, of course, to the Structural Summit.
Well, it's a huge pleasure to be here. Thank you.
Thank you so much. So I would like to hear from you, what's your vision for the future of education in the interventional world? You've been very active organizing and promoting meetings, specifically, for instance, just to talk about structural intervention. Do you think this is the future? We're gonna gradually perhaps migrate from the large, big meetings that we can talk about everything in a more superficial way and move to the more specific topics, or there is room for both?
Well, I think there's always room for both, but I think the success of the meeting here in Sao Paulo this week illustrates the fact there is a huge need, a huge appetite for education in the field of structural intervention. Every year, more and more people are joining the field, the next generation of interventional cardiologists. Let's also remember our imaging specialist colleagues who are fundamentally important, and also our surgical colleagues who are also excited about the growth of transcatheter interventions. All of these communities need a lot of education. But at the same time, I think we shouldn't forget that our interventions sit within the spectrum of the patient's lifetime.
Exactly.
We need to make sure that we are diagnosing them correctly, that they are surveyed correctly, they come forward to the intervention at the right time, and then they are also managed appropriately after the intervention. And that's where the interface with clinical cardiologists is also fundamentally important.
Yes.
So there's a lot to cover.
Yeah, of course, and they're the ones that see the patients first, right?
Exactly.
But moving more specific in terms of training, do you see the value of perhaps investing more in training villages? I mean, you know, with the PCR family, we're very active to organize meetings, including simulators, lots of resources in terms of how do you do septal puncture, how do you deploy the valves high, low, etc. So all these technical details, how do you see the future in terms of technology and embracing that more often in the meetings?
Yeah, so there's no question that the hands-on, in-person experience is very, very important for education. We learned during COVID that we could manage, we could communicate virtually, we could share PowerPoint, we could share information and data, but we lost out on the hands-on experience, and we learned when we came back after the pandemic how fundamentally important that was. Together with, of course, the opportunity to network and to meet with friends and colleagues, very, very important. But a focus on the hands-on, the simulation, the learning in a small group format is a unique experience.
And I'm also very impressed how we evolved from being an interventional community to now, for instance, embrace and include the imagers, right? I think that we created a new specialty.
No, for sure.
And without that, we don't have the proper roadmap when you talk about structure.
Yeah.
What's your vision for the future? What kind of investment you plan to do in terms of bringing this technology, this 3D, holograms, etc., and the negotiation with the leadership in the imaging field?
Yeah. So we've no doubt seen this week in the live cases that we've seen, the recorded cases, the power of imaging, not only in diagnosis, but now in guiding our procedures. And that's particularly important in, let's say, mitral and tricuspid interventions, where the beauty and the power of imaging is exquisitely demonstrated. We've learnt in PCR, for example, that we need to now embrace the imaging community. We need to work hand in hand with them and make sure that all the rapid advances they're making with their 3D reconstructions, their virtual imaging, their holograms, their simulation techniques are translated into the procedures that we do in the cath lab. And I think it's also fair to say that without the images, the structural interventionists can't do their job any longer. So we need to learn to work together, we need to develop a common vocabulary, and we need to work on a relationship that will take us forward.
Wonderful. Thank you so much. Thank you for your time. Thank you for your presence. It means a lot to us to have you here, and we are looking forward to a very strong and tight collaboration in the future.
A growing collaboration. Thank you very much.
Thank you.